Want to put up the slide?
Oh, okay. We are here, and I will start with this. This is my first time as a host of one of these webinars, so hopefully I won't be too technically challenged here.
Welcome, folks, in. We're so glad you can make it. My name is Kelechi Bozo. We have Paul Simmons, who's hosting us today. We're going to give it a few more minutes to allow folks to come in. Paul, is there any way to make the slide deck bigger, or do you want me to try to share it on my end?
Well, let me see.
Yeah, present mode, yeah.
Full screen or?
Mm-hmm.
Oh. That's big.
Yeah, that's great. We can see it now.
Okay.
Welcome in, folks. This is Californians Against Prop 1, a deep dive into involuntary commitment and its implications. We're going to just give it a few more minutes for folks who are arriving. But if we just want to say thank you for being here today and welcome in.
Oh, there we go. I couldn't see who was here, but I see we've got over 40 here, so good. Yeah, that's what I was going to do, Sharon. So I'm going to try to do that. See if that works. Aha!
That
Well
works.
done, Sharon.
No, well done to you, Paul.
Oh, no.
All right, maybe we'll give it one more minute and we'll go ahead and get started.
That sounds good.
Does that sound okay? Thanks again for joining us today. This is a Zoom webinar, so we will be presenting shortly, but you'll see there's an area for questions as we start to present. We will also have time at the end for Q&A, so feel free to add questions along the way.
Thanks, Kelechi.
Welcome.
I'm good with her being the boss because, like I said, I've never actually hosted the webinar. I've always done just the regular Zoom meetings, so I'll just suffer. And hopefully you guys,
No, you're great.
hopefully you guys won't suffer too much with me.
So the first question already is in the chat, which was from Patty. Will you be recording this meeting? Yes, we will be recording this meeting. So we're currently recording. So we should be able to send out a recording at the end along with some resources when we're done. Paul, do you want to go ahead and get us kicked off and introduce yourself and start?
I think
it might be that time.
It is. I always like to have everybody here, but you never know how many people are actually going to show up that were registered. So we're around 50 people. So that's a good critical mass, so to speak. So anyway, I'm Paul Simmons. I am on the kind of the part of the leadership team for the campaign against Prop 1, Californians Against Prop 1. I'm also the co-founder of the Depression and Bipolar Support Alliance of California. So I've been in the space of mental health for some time. And you see other people's pictures there who are all going to be speaking at some point. So we'll do those introductions as we go along. Let's see. Oh, says chat is disabled on her screen. Okay. Hi, Andrea. Kelechi, do you know how to enable chat on?
Actually, for webinar, I don't. A lot of times we don't have chat, but feel free to add in questions. That's the way we can really kind of go back and forth with you all.
Yeah, okay. I'm gonna check just real quickly before I go on. Aha, okay. So I think I have fixed the chat. Attendees can now chat with hosts and panelists can, I guess, do whatever they want. So,
Within reason.
very good. Okay, can people hear me now? Okay, okay, good. Alrighty, so we will get started and let's see. There we go. So time to grab our suitcase and open it up and look at all the stuff that we don't want anybody to see. And one of the things we don't want anybody to see, or one of the things that the governor doesn't want anybody to see, is really how complex and how a lot of the aspects of Proposition 1 roll out. So what I'm going to do is to just give a really brief summary of what Prop 1 is. It has two different pieces. One is changing the Mental Health Services Act, and the other is a bond issue that's going to be put there for $6.5 billion, give or take. So Prop 1 would amend the MHSA, which is the Mental Health Services Act. Now that was Prop 63. For those of you who are in the mental health space, 20 years ago, it was passed by the voters, put on the ballot by signatures, and it basically was a millionaire's tax. So anyone who makes more than $1 million a year gets taxed an extra 1% in the California taxes. And that goes into a fund, which is called the Mental Health Services Fund. And it currently funds prevention, early intervention, and other services for people that are either mild to moderate in terms of their mental health issues or at risk or moving into a serious mental health issue or SMI. Now the current MHSA, as I said, raises a 1% tax in California, and it allocates revenue to counties for funding different mental health services and programs. So how it works is it's all collected basically through the, I guess, franchise tax board or some special fund, and it goes into this fund. And at the end of each year, once once all that money has come in, then they determine by a formula where that money is going to go. What county is going to get $1 billion of it? What county is going to get $380 of it? Basically, it's based primarily on population, of course. So obviously, Los Angeles County, San Francisco County, San Diego County get a lot of money. Mono, Inyo, some of the really tiny counties don't get a whole lot, but per capita, they get a relatively even amount of money. And it gives them to that so that they can put together programs, which are put on and developed locally, and sometimes they're shared between counties, et cetera. But the primary focus is prevention and early intervention services. So this is really important because this is one of the most important things that is being changed or is being proposed to be changed by Proposition 1. So we'll get back to that in a second. Adult and children's systems of care are included in the current MHSA, or Prop 63, supporting individuals with severe and emotional disturbances. In addition to, and we'll get to this later, some funding for substance use disorder, patients with substance use disorder, and then services for homeless individuals, offering mental health support alongside of helping them to become housed. So you'll see some of this stuff is going to be referenced by the Prop 1. So the real changes are that it renames the act to the Behavioral Health Services Act. That's not a big deal, really, in a sense, except it is rather meaningful in the sense of the overall picture. About probably 5-10 years ago, all the mental health agencies in the government and in a lot of states, they started calling themselves behavioral health because that includes substance use disorder. So it includes like opioid epidemic treatments and such as that. And what this will do is it'll expand the scope to include substance use disorder, which I just mentioned, but now it's going to be available to people with just substance use disorder. The current MHSA funds services for people with substance use disorder as part of their mental health treatment. This would take a bunch of money from that fund and put it into a fund just for substance use disorder. It requires counties to spend 30% of the funding on housing related services. They're calling it housing interventions. And essentially that's not housing per se that the money's going to go to, but interventions to supposedly, I'm not sure how effective it'll be, but supposedly to help people get into programs where they can gain supportive housing. And that's where it goes into the bond, which is supposed to build some of that stuff. Okay, it increases state oversight, and by oversight, basically 150, $180 million a year are going to go up to the state agency, the Department of Healthcare Services, to provide what they're calling oversight and accountability. Now, there's already an organization called the Mental Health Services Oversight and Accountability Commission. They will remain, they've been doing the oversight and accountability previously, but they will remain, but more or less will then be answerable to the Department of Healthcare Services, and they will have the bulk of the control in terms of actual power. And then the $6.4 billion bond, which is going to fund the construction of new treatment beds and supportive housing units, specifically for people with severe behavioral health needs, and of course, behavioral meaning not just mental health. So the bond originally was written to provide housing and to build housing for veterans who are homeless, who have severe mental illness, who have different issues, and to try to help them. But when the governor put forth this renaming and repurposing of the Mental Health Services Act, it kind of got combined with that. And the statements that are being made are that this is to help people get housing. And some of this money will go for actual housing units, but the vast majority is going to go to basically create new treatment centers, basically hospital beds for people that primarily the homeless, but other people who are in that position. This is really centered around the homeless issue. The governor is framing this as basically a solution to the homeless problem. Okay, so this proposition would reduce the amount of funding that goes to cover mental health services. And this is to the tune of about $1 billion a year, less than is currently going for mental health services. And I mentioned that some of the money is going for the substance use without the mental health services. Some of it's going to the state for that oversight. And some of it is going for the housing interventions. So these are some of the consequences that we see. There's going to be reduced services because they're cutting $1 billion out of services. That's not hard, or mental health services. So the mental health services that are currently being funded by the Mental Health Services Act are going to see some fairly drastic cuts. There are going to be a lot of programs cut. The Prop 1 does not indicate what's going to be cut. But what it is going to do is going to basically shrink the pie of available funding for the people that are currently giving these services, and for them to gain this funding is going to be a lot more difficult, and there are going to be programs cut. The local programs, the locally developed programs that are done with community-based organizations, et cetera, are going to be most likely to be cut. So funding cuts may force mental health programs, sorry, something's in the way, to reduce the scope. And the biggest fear, I think, is that the organizations and the programs that are doing specialized programs for specific populations like children, adolescents, veterans, people of color, LGBTQ. So the programs that are really focusing on a specific population, really drilling down to see what they really need, these are the programs that we see as being most at risk. With fewer resources, of course, we won't be able to spend as much on each patient because we're going to get a decreased quality of care. Money's not everything, but it does take money to provide quality care. So we already have some of these issues. We have rushed appointments. I'm with Kaiser myself, and other people with Kaiser probably recognize that Kaiser, like other programs, you can wait quite a while in order to get the care, and then it's rushed through. And there will be increased burden on other systems. So if people can't get the mental health care that they require.
57.
Pardon?
I'm not sure what happened. Just keep going,
Okay.
Paul.
Okay, I wasn't sure if it was one of you or somebody just got unmuted. Okay. So if they can't access the regular outpatient and community-based services, prevention and early intervention, they're going to end up turning to the emergency room or the criminal justice system, leading to increased costs. And this is just a basic pie chart. It shows where the money's going today and where it would basically go under Prop 1. Non-FSP community services and supports and prevention and early intervention and innovations are the things that are primarily locally based and that they're being changed a lot. If you look at this 38% goes to 33%, but it also includes the early intervention innovations. So there's no money that's specifically going to be designated for intervention or innovations or early interventions. It's sort of in a great big pie that was at, let's see, this is 57, 60, 62% of it is now going down to 33%. That's pretty significant. That's half the money when it comes right down to it. Full service partnerships, that goes down a little bit, but that's kind of a tried and true system for wraparound services so that people who need care do get all the care they need. So that kind of harkens back to the fact that people with mental health treatment under the MHSA also got treatment for substance use, even though that wasn't considered an actual mental health issue. So the key issues there are innovations, housing, and then this 5%, that's what's going up to the Department of DHCS or Department of Healthcare Service, DHCS, and they will basically be getting $150, $180 million a year out of this pie that used to go to services is now going up to the state. There's already that much money going up to a state agency that was created just for the purpose of overseeing and this particular fund and holding them accountable. Okay, so that's the basics of what it is. I'm not going to get too much into I guess, arguments about what's good and bad at the moment, but we'll get to some of those as they relate to some of the stories. So I'd like to turn this over now to Sharon. Sharon, can you unmute? You can. Good. Now
Sure.
I get to mute.
Oh.
Thank you.
Do you want me to jump right in?
Jump right in.
Okay. So my name is Sharon Sabota. I'm a journalist. I report for East Bay Express, KPFA, and a number of other publications. A trusted acquaintance and friend of mine who is involved in the No on Prop 1 side had said, "Hey, do you know much about this issue? Why don't you dig into it?" So I jumped in July, not knowing, and I, like, on paper, like many people, I thought, okay, conceptually this makes sense, right? And I think what I learned from the folks who are on the side of yes, as I've dug in, is that it only makes sense if you look at it just at the very surface level. And if you don't look at it, if you're talking to the folks who are on the ground doing harm reduction work and interacting with people who've been impacted, you start to get a different lens and you see that a lot of stakeholders were not at the table at all during this. Rather than telling you about, so I'll just say that I've been talking to harm reduction specialists, people who are on the streets doing nursing, housing advocates, people with direct lived experience and then I don't write about this or talk about it in my journalism work, but I'm the daughter of somebody who, with lived experience, who at times experienced homelessness, who had bipolar schizoaffective disorder. So I definitely had a personal interest in digging in and talking to people on all sides of the issue. And so I'm just going to highlight a little bit of one family's story. I came to know a really amazing woman named Julia Ford. Julia is a woman who experienced trauma in her lifetime, had some definitely a collection of adverse childhood experiences. In talking with her, she thinks that perhaps her mother might have had some mental health challenges and there wasn't a way to get support. She mentions like there was just stigma. It was very taboo for people who were Black and poor specifically, which were her identities, to reach out. And her mother was a single mother of 6. So she ends up with her own set of challenges, does develop a dependence, like has a professional job as a hairstylist. Then she ends up with a dependency issue and lives in an abandoned school bus. And eventually was getting some encouragement from folks, but she used to see commercials for the Healthy Baby Project. And then when she was in her 3rd trimester of pregnancy with her daughter, Majida, who's here, who I'm going to introduce to you in just a minute, she went into treatment on her own, stayed there for a year. And she'll talk about that, and Majida will talk on her mother's behalf. But I came to know Julia, who at first thought, oh, maybe SB 326 isn't so bad because it allows people like me to get support. Then she said, hey, Sharon, by the way, my mom is conserved by the state of California and I need to figure out would you like to come and interview her? So I went with. And then we started to look at the interconnectedness of all these issues. So Gaynell Hamilton is her mother, and you'll get to hear more about this family story in a minute. But she's conserved by the state of California. And the intergenerational trauma that comes along with this, the number of people in this particular family who've experienced housing insecurity, poverty, incarceration, and then this is just like intergenerational incarceration. So now Julia would love to be able to care for her mother. It's very difficult in her case to reserve the conservatorship. So Julia comes to Contra Costa County, to another portion of the county, to care for an elderly white woman while her mother is conserved, and it's very difficult for her to get out. And her diagnosis is she has bipolar disorder. And so I'm going to turn it over to her daughter to share a little bit more about the family story, but I just wanted to sort of share the weight of the injustice of that. Part of the reason that Julia's not here today is her own husband is dealing with some pretty major health issues and is getting treatment. So there's we can just see all kinds of systems coming together, right? We can see mass incarceration, or like the systemic impact of incarceration and the way that might look different. Maybe somebody's incarcerated in a hospital because they're in a locked facility against their will, when maybe a relative might be able. There's a feeling by some folks that it's infantilizing, that there's one of the harm reduction specialists that I interviewed, Maurice Bird, who does direct service work with people in encampments who might be looking for services. He says that when he finds people that are ready to go into treatment at like TAP, treatment access program, and they'll call and say, I'm motivated, I want to get treatment today. They'll say, call back tomorrow, call back next week. And so the concerning part is that it sounds like there's not going to be more effort put into bolstering those types of programs, but it sounds like involuntary access points might be the way to go. And so it seems to be taking away agency. And so that's that is kind of where I've landed as a journalist who's been digging into this, who's reflecting back on spending a lot of childhood in different psychiatric facilities, visiting my father. So I don't want to take too much time here, but I do want to, is this an appropriate time to go ahead and welcome Majida Wesley to the conversation? I'm going to just assume that that's a yes. So
That's a perfect
Yes.
timing. Yes.
Can you unmute and jump in and share a little bit more of your family story and your own? Welcome.
Thank you. Yeah, I think you did a good job of explaining my mom and grandmother's story. But yeah, I think a big part of Prop 1 that we take issue with is the portion that does take away the agency of so many people. And like Sharon said, my grandmother's in a conservatorship where we're not able to get care of her. And we see the impact of that. But also, I'm formerly homeless myself. So I was homeless when I was in college. As she said, my mom was homeless and had substance issues when she was pregnant with me. And so we have plenty of experience there, but we just, yeah, we take issue with Prop 1 just for the piece of taking the agency away from people, assuming that the solution is, the treatment centers, and taking the money away from the local governments that already contribute to these issues. But yeah, if you have questions that are more directed, I'm able to speak to that.
Majida, can I ask you a question about what it's like to not be able to care for, like, how has this impacted your life and your family's life, the conservatorship?
Yeah, I mean, it's impacted us greatly because all of our ability to take care of my grandmother has been taken away from us. So we don't have that ability to really make the decisions that are in the best of her interest. We have someone who we don't really know, we don't have a relationship with, making very important decisions for her life and really for our family's life without any input.
Thank you. And I think the other thing that you brought up a couple of times with that agency is really important. Can you tell me, for folks who think, people who have lived experience or have been unhoused don't deserve rights? Could you speak a little bit to the importance of agency and recovery?
Yeah, for sure. So I know in my mom's story, my mom's recovery was made possible because she wanted recovery. She made the decision to go and get treatment. She made the decision to, and I know it's getting dark over here, so I have to turn the light on, but she made the decision to go and seek treatment. And that was when she was able to finally recover, is when she was making the active decision to go and do it, and not when someone was forcing her to do so. And I think that's a huge portion of the solution that isn't being solved when we are conserving people or forcing people to get treatment and not allowing them to make that active decision for themselves.
Thanks. And I think the last question might be, and feel free after that to ask a question before we kind of move on, is what would you tell someone who's on the fence of Prop 1 right now, who thinks, wow, it sounds really good. Maybe that was just your situation. What would you tell that person who's still kind of trying to figure out what they want to do when it comes time to vote?
Yeah, I would tell them to look more into Prop 1. I know for me, I've listened to a bunch of podcasts. Oh, it's really dark over here. I've listened to a bunch of podcasts about Prop 1, really to listen to the pros and the cons, because when Sharon first reached out, and I spoke with her because my mom had already been in contact with her, I needed to educate myself on the prop. And, from the surface, it sounds good. I don't think anyone on the surface would say like no to housing the homeless or no to getting people treatment. But once you start learning more about the proposition and how it's going to be taking funds away from the local governments, who a lot of the podcasts and the experts on the issues that I've listened to have said that the local governments that are engaging in the assistance are doing a great job. So I think that's what I would say, is just do more research.
I think Sharon has a question for you as we wrap up on your story.
Well,
Yeah.
I'm going to just leave with one last thing. So one thing that people are saying is like, we're going to fix mental health issues, and then housing is just going to be resolved. That's kind of the oversimplified way. And one thing that I learned from talking with Majida is how like her lived experience of living in the shelter while going to college kind of dismantled that a little bit. And I wondered if you could just share like how you saw the process of housing insecurity impact mental health as opposed to the opposite way.
Yeah, so I think one common misconception that people have about the houseless population is that they're homeless because they're mentally ill, or they're homeless because they're using substances. When I was in a homeless shelter in Hollywood, and I was at the Covenant House in Hollywood, I seen very often where people would come in and they weren't using anything, at least from what I could see. And we were with them for extended periods of time, sleeping in shared rooms with them and everything. And they weren't dealing with any mental illness that could be seen, at least. But within a matter of weeks to months of being in the facility and having to, because in the facility we were in, every morning you'd have to leave and you weren't able to come back in there until the evening. So people had maybe 8 to 10 hours a day where they had nowhere to go. They just were outside. Thankfully, I was in college and I was working 50 hours a week. So I was never there during that period of time. But a lot of the people that were there were finding substances because they had all of this free time that they were outside of the shelter, and that was leading to mental illness. So I would see people come in day one, and for whatever reason, whether they aged out of the foster care system or they became homeless some other kind of way, it would go from them being homeless to them now being substance users to them now visually you can see that there is some mental challenge or something that is combined with the substance use. So I would see that progression versus I think the assumption of homeless people is that they're dealing with substance or mental illness first, and then now they're homeless.
Majida, thank you so much for sharing your insight, sharing your story. Sharon, thank you for coming on and introducing us. I think we probably have Latanya up to share her story up next, but I just want to say thank you. That perspective of understanding that lived experience from someone who's been unhoused and who's been around folks who've been unhoused is really, really pivotal. Any last thoughts?
No.
Perfect.
Thank you, Majida. My name is Latanya Richard. I am a certified Medi-Cal peer support specialist. I am founder of Peer Voices of Merced County, the Shane Street Project. I have a lot of lived experience in a lot of different areas. I have been unhoused because of my mother's financial issues. I have been addicted to opioids because of doctors overprescribing me medication. And for the last 20 years, I have been misdiagnosed as bipolar and schizophrenia. I was given all kinds of medications and deemed, they say, treatment resistant. And even though I tried to fight for myself and say, I have never had any of these symptoms, I don't understand. Yes, you are, you're sick, you need to take these treatments. And I got 4 rounds of ECT that destroyed my cognitive function the way it used to be, my memory. And the last round of ECT, because I was an opioid user, my doctor used that as a reason to conserve to 5150 me, because after the ECT, my blood pressure dropped and I almost died. And so when I woke up, he said, well, you took pain medicine before the surgery. I know I didn't. Yes, you did. And before I could even say anything, he had police come while I was still in the hospital gown and handcuff me to a wheelchair and take me from the surgical part of the hospital up to the mental health part. And I was locked in a small room. They forced me into the thing, and I fought because when I know that something is wrong and it is unjust, I'm going to fight for myself. And now I use all of that crap to fight for others. It's the systems fail all of us, and it's not for housing, it's not for homeless. Christina, you have a question? I saw a hand. Christina?
We were gonna hold the questions
Okay,
till
okay.
the end,
Yeah,
but
yeah.
feel free to add
Okay.
it to the Q&A,
Okay.
Christina. Go ahead.
Um, I had a really, really rough childhood, really, really rough childhood. And because of that, I never wanted kids. I didn't want children because I didn't want to pass that down. And when I fell in love and decided to have kids, I wanted to be the best mom I could be. And because I was depressed and went to a doctor who I found out later was doing the same thing and misdiagnosing a lot of people, I left an office with an appointment that should have just been depression with 12 very strong antipsychotics, medications. And people don't realize that Black and brown people are misdiagnosed at such a high rate, such a high rate. Nobody really cares. And we're fighting for that. And if you guys are like seriously even doubting that Proposition 1 is a good thing, I mean, thinking that it's a good thing, it is not. It is not. Not just a community-based organization, but real lives will be impacted. My children lost out on what could have been a great childhood because of doctors not listening to people, because of racism, medical racism, flat out. It's a shame, and we need to change it. And yes, medical racism is very real. Medical racism is very real. I literally still have to take people with me to doctor's appointments because doctors say the meanest, worst crap to me, period. And it gets to a point where you want to give up, but then I realize that other people are going through it and I can't give up because I'm going to fight for the rest of my life to make sure there's equitable care for everybody. And if that you can't give equitable care and you're a politician, you're going to lose office because I will fight for the rest of my life to make sure you never hold political office anywhere ever again. Thank you. Are there any questions?
Thank you so much, Latanya. That was really, really, really powerful. I know there were some slides to kind of go with
Yeah.
things. I don't know how to access that because Paul has them.
Paul, can you read the
You-
slides?
Yeah, there were some other points, but I just want you to see that you're getting some love in the chat, that people are really appreciative of you fighting, that, folks want to be part of your story, want to hear more about your story. So I wanted to make sure you heard that as well.
Oh,
Okay.
thank you.
Yeah. Okay, so that
Oh,
you
can
have
you
the
make
slides
it
10 and
bigger?
11.
They're really
Yeah,
small.
make it bigger. Yeah, I've got glasses on, but I don't have
I know.
glasses.
I can't see that at all.
While we give Paul a few moments, just want to ask folks, feel free to keep throwing love in the chat, support in the chat, but also add your questions to the Q&A. We see a lot of them. So, all right, go ahead, Latanya.
Okay, so increase in involuntary treatment. Prop 1 comes after several changes to the state's mental health system, including the launch of Newsom's Care Court, which he's now trying to be nice and call it Care Act, but it's still the same. It's still horrible. System for people with serious mental illness and dramatic eligibility changes for conservatorship. These changes are expected to result in more people being placed in involuntary treatment. And it's just like a blank warrant. It's a blank warrant. Increased involuntary treatment. Proposition 1 does not directly advocate for increased involuntary treatment. However, it does indirectly lead to more involuntary commitments through increased emphasis on involuntary treatment within care court. Increased availability of treatment beds, potentially more court-ordered treatment more feasible, making court-ordered treatment more feasible. Next. The possible rise in involuntary commitments, along with the decrease in mental health funding, will strain the mental health system and affect the level of care. So the community-based organizations that are currently keeping people stable, they're going to lose a lot of funding, and the people that are stable will probably more than likely end up in a mental health crisis, which of course is going to cause people to lose jobs and then of course become unhoused. So the system is just rolling around and cycling to make it worse. Additionally, the financial consequences of this proposal could have lasting impacts on the state's budget. It is essential for all of us to grasp the significance of Proposition 1. The possible increase in involuntary commitments, Prop 1 would allow for more involuntary assisted outpatient treatment, which would help ensure people with severe mental illness receive treatments. However, we argue that this could lead to an over-reliance on involuntary measures and infringe on individuals' civil liberties instead of addressing long-term housing. This bill would lead to judgment and conservatorship, which means loss of self-determination and civil rights. Decrease in mental health funding, Proposition 1 proposes some funding increases for mental health services, but also diverts existing mental health funds to supportive housing. Supporters argue this is necessary to address the root cause of homelessness, but we worry that it will leave existing mental health programs underfunded. Yeah, this is Kelechi's story.
All right. I don't know how to highlight myself, but if someone could put me back up, that'd be great. All right. Hi, folks. I'm Kelechi Bozo. Thank you so much for being here today. Thank you, Latanya, Jeed, Sharon, and Paul for presenting, for sharing your stories. I'm going to share a quick story, but I also have seen some kind of questions about other forced treatment. So I want to talk about that. But first, I just want to ask you to imagine your life trajectory being judged on your lowest point. So maybe it's a day, maybe it's a week, maybe it's months or longer. For me, it would have been the day I tried to kill myself following a sexual assault, and I was voluntarily committed. And I just want to say for folks, part of my story is triggering. I don't do it to shock people. It's to tell you that it's not even shocking in my community of peers. Like when we share our stories, it's like, oh, that happened to you too. So I say this, that when I was involuntary committed, I was treated like a burden. I was told not to let myself get raped again by a nurse. And as a Black woman, I always have to think about racism, historical racism. How does that play into my treatment and my care? And at the hospital, what I received instead of peer support or even therapy was chemical restraints. So for folks who don't know what chemical restraints are, Latanya talked about it. It's when you're overly medicated. So you're on a cocktail of something and you're on a spaceship and you're gone, right? It's hard to make any decisions. It's hard to be really present. It's hard to really be clear. But it's a way of basically controlling your body. And I experienced verbal abuse, and the treatment modality was really coloring and watching movies, including Silence of the Lamb, which I asked, is Silence of the Lamb in a psychiatric ward an appropriate movie choice? I was told I was so high functioning, right? That's another way of showing racism. So I want to say there was no therapy, there was no dignity, there was no peer support. I didn't have any choices. I was told when to eat. I was told I had a mental illness, that I would never work. I would never get married. I would never amount to anything, and that I would be a burden on the system. And this is from people who were supposed to be in charge of my care. And so I want to double down and say my story is not rare. It's not unique. And a lot of people don't know what it's like to have someone make all of your decisions for you. So when you hear things like Prop 1 is going to provide housing, and that housing equals hospital beds and institutions, these institutions, this is what I'm talking about. This is what happens in institutions when you're put away. So yes, your family knows where you are, but they don't always know what's happening to you, as we heard in Majid's story. And the space to heal wasn't even healing. It was overcrowded, it was chaotic. And then I was just sent away with like no support, no supportive linkages, no community-based programs. So I would say if the current treatment is traumatic, why would we expand something we know doesn't work? And it really took a lot to recover, not only from the trauma of the sexual assault, but actually the trauma of the institutionalization. Like those were the traumas. I added more traumas in being in the system. So I do want to note that what really helped me were things that like Mental Health Service Act funds, peer support programs, voluntary trauma-informed therapy, and a belief that people can and do recover. I think that's also something that's missing from the conversation, is that people think we are so broken that we will never heal. But we are misdiagnosed, we are forced, and we are not introduced to healing a lot of times. So I'm really concerned about the beautiful programs that are going to be cut because they're upstream and they are actually healing centered and healing focused and full of people with lived experience. Also, I saw someone put something about care court being voluntary. So I just wanted to quickly say that, and you can put the slides up. Care court begins with an involuntary referral to the court by a family member, a police officer, or a government official. Treatment is imposed by a judge and then enforced with sanctions. So those sanctions are hospitalization. We already talked about medication or conservatorship. We've talked about all three. So you'll hear people say that it's voluntary treatment, and the media covered it as voluntary treatment. But I'm going to tell you all, how can something be voluntary when there are consequences for not following through with your care plan? If someone decides where you live, what medical treatment you have, and if there's anything like non-compliance and you could be forced into a conservatorship, that is not voluntary. Anytime there's a consequence for not doing something, that is not voluntary. So I bring this up to kind of show you the connection between all of these laws that are coming out right now, right? So we just talked about care court, which, I just shared that. And there's also SB 43, which expanded the definition of grave disability to include substance use as a basis for conservatorship, which will subject more people to involuntary hospitalizations and conservatorships. And so look at this as like this three-legged stool where you're seeing that these mental health bills, these policies that are getting passed are actually really, really harmful, but they look on paper like they're something good. But this is a political use of psychiatry. Like, so just to be clear, forcing someone to do something against their will is forced treatment. No matter how pretty the language is, that's one of the reasons I'm against it. So if you are non-compliant, if you are Black and brown, if you are unhoused, if you're queer, if you are someone who the system deems as a danger to themselves, and we are usually on the other side of harsher measures. And this really perpetuates stigma and stigmatize Black and brown folks further. So again, I'm just going to leave it with trying to help someone who's living with a mental health issue by taking their rights away exacerbates the problem. And researchers have even found that forced treatment contributes to quote unquote non-compliance. And I think the last thing on this is it's a strain on the mental health system. We're actually underfunded. The behavioral health system is absolutely underfunded. So to take funding when we're in the middle of a mental health crisis, when the pandemic that is not over for a lot of people with disabilities is still happening, and we're dealing with more like higher suicide rates. We're dealing with like a lot of mental health challenges right now. To take money away from something to fund forced treatment, not a win for us. So Prop 1 includes funding for additional treatment facilities and staff, but it's not going to be enough. And some of the financial consequences, it authorizes $6.4 billion in bonds, which is going to add to the state's debt. And the long-term financial impact, we're not sure what it will be, but opponents argue that the costs outweigh the benefits. So if you're someone who is like, all of these bills sound good, all of this sounds good, think about who's against it, right? People with lived experience are against something that's supposed to help them. That should make you curious. So we can stop the slideshow for a moment. I'm going to go ahead and actually introduce someone who has been doing some really important work around this. His name is Rob Wypon. He is a freelance journalist and creative nonfiction writer who writes frequently about the interfaces between psychiatry, civil rights, policing, surveillance, and privacy, and social change. His articles have been nominated for 17 magazine and journalism awards in science, law, business, and community issues. and he's the author of the book, Your Consent is Not Required, The Rise in Psychiatric Detentions, Forced Treatment, and Abusive Guardianships. So it's my honor to have Rob join us today and welcome him to the stage.
Thank you, Kalechi, and thank you, everybody, for those amazing sharing before me today. Yeah, I mean, if you're wondering why and how I got into this issue, aside from the fact that it involuntary commitment touched my family, but it's also because I've met so many people over the years who've had these kinds of experiences that we've been hearing about today, and you know, it just compelled me to try to learn more and to write about it. I'm going to put a few things in the chat there now. Just any references today, you can email me, or that link would have most of them. And also a link to a talk I'm just going to mention. It's a really cool talk by a psychiatrist of all people, but it's very good about structural causes of homelessness. He's from UCLA, so it was in California focus, and solutions like housing first and how to really make that kind of program work. It's a great talk, and it's something you can share with others to help educate, I thought, around this. It's not about Prop 1 specifically, but gets into a lot of the key issues. So I'm going to share, I got some slides here that I want to share. So I'm going to try to do that now. Where's my screen sharing thing? All right, there. Share. Okay. All right, so that's just my book there. All right, so some of this we've covered. I'll just jump through it quickly. But, you know, it's interesting. A lot of people talk about violence in relation to these issues, you know, that somehow everything California's been doing over the last while is going to address violent mentally ill people. Well, in fact, almost none of it touches on that. Seriously violent people, they're usually committed under what are called forensic and criminal law. Whereas what's really being talked about in all these legal changes are surrounding both voluntary mental health services and civil commitment or involuntary treatment for people who are, generally speaking, relatively nonviolent and law-abiding. And so that's just important context for everything we're talking about today, because often they refer to, people who push somebody threw somebody into the subway tracks, and that's the person we're dealing with. No, in no way do any of these laws even kind of get near cases of that kind. They're much more like the kind of cases we've been hearing about tonight. People who are just really struggling and maybe even reaching out for help, and their services are going to be cut back, or they're going to be subjected to forced treatment. So what is involuntary civil commitment? Well, it's a lot of this. Whoops, sorry. Oh, no, sorry about that. So yeah, they can involve any of these kinds of things that people have already touched on, you know, police apprehension, short or long-term locked or semi-locked institution, or coercive home visitations. I'm going to talk a bit about that because this is actually a major phenomenon in California, even though it's not strictly speaking being done under legal provisions right now. It's being done quasi extrajudicially, if you will. Security guards, threats, including the pressure to sign in as voluntary. Your belongings are taken. You can be subjected to forced stripping, restraints, seclusion. There's monitoring and surveillance, often tranquilizing and sedating drugs that can be injected if you put up any kind of resistance. And electroconvulsive shock therapy, it can still be done against people's will. So how do people feel about this? Well, the kind of things we've been hearing tonight are not uncommon at all. Like perceived coercion is the key factor here. There are people sometimes who will say, hey, I was grateful that they stopped me from doing something that I might have otherwise done. And usually what you find when you delve into those kinds of stories is that they were collaborative experiences. The person was treated very respectfully. They were talked about, or do you currently take some kind of medications? Have you ever tried any before? Would you like to? And it's a very respectful, mutually collaborative experience. And in those kind of cases, as you can imagine, it can sometimes turn out okay for somebody and they may be somewhat grateful. But more often, if people put up any kind of resistance saying, I have tried that drug, I didn't like it, or anything like that, they find these experiences very humiliating, traumatizing, terrifying, brutal. These are the kinds of things we hear all the time and appear in the scientific literature about this as well. Or chemical straitjackets, permanently damaging experiences, and comparisons to prior physical and sexual assaults are terribly, really horrifyingly common. We'd have to say how often people who've been through these kinds of experiences say this was the same or worse for me to the supposed help that I got. And so what percentages are grateful? It's hardly ever been studied, but there's interestingly one done in the United States where they looked at assisted outpatient treatment, which was forced treatment in the community, and found that 72% of the people after a year were still saying, I am not grateful for this experience. And they were getting all kinds of supports as well, too. So it's really kind of sad. And it really shows you how much people can really hate the coercion generally, but particularly the coerced drugging. So recent California developments, these have been talked about, so they're just highlighted here. The expanded commitment criteria, expanded conservatorships under the care courts. And I want to highlight that there could well be many more full service partnerships, because a lot of the quote unquote housing interventions that are being proposed will be full service partnerships. So it's still kind of up in the air, but it really does seem that there's going to be a lot more of those, and that's going to be more relevant in a second. And then there are definitely going to be many more detention centers and what I would call coercive facilities under Prop 1. And this is highly relevant. We're going to get into some of the data. So does California have a shortage of 10,000 beds? This is what the government's been saying. This has been repeated ad nauseum by the media. It's actually written into the legislation. If you want to go look at some of these laws, they'll say, oh, 8 to 10,000 beds short. Well, that comes from a RAND study that was recently done. I'm not going to criticize the RAND study per se. It's fairly clear what they did and didn't do. And, it's forthcoming, but it's been very misrepresented what they actually found and what they didn't find. So yes, since the 1950s, we've got far fewer beds in state psychiatric hospitals, but beds in all sorts of other facilities have gone up, 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 and nothing but up. And the RAND study left out all kinds of beds that they could not really get good numbers for. So that included all psychiatric facilities for children and youth, just not included in their numbers. Supportive housing, group homes, largely not included. Full service partnerships were not included. And this is highly relevant because the numbers we have show that 45,000 up to 80,000 is actually the number I just got today in a back and forth with the government around this. They're not really sure. They don't even have really good numbers on this, but it's somewhere in this ballpark of 40 to 80,000 people. So look at that number right there. If you included those numbers alone, you've got 4 times as many beds. And here you have to say, what is a bed? Well, a bed is not only necessarily a psychiatric hospital. It can be, in the case of FSPs, it may just be an ordinary home where the person is getting psychiatric supports. And that's relevant because that's often what the asylums were in the 1950s. They weren't like these amazing places where people had a grand time, right? So if we're going to make comparisons in what is a psychiatric bed then and today, this is all I'm trying to highlight. Like, you may have problems with some of these types of situations that people are in. They might be in a motel room or something like that. I'm not saying these are great beds. I'm just saying we should be counting them because people are getting coercively treated in these environments. They're getting mental health services of some kind, and they should at least counted and accounted for when we're kind of talking about what's happening in the system today. And they also didn't count prison units and established treatment programs within prison, which would be tens of thousands more. So why is this relevant? It's because it's showing you that the extent of coercion going on in California today already seems to be so high, much higher than it ever has been in history. That's what it seems to be. And is that the case? Yeah, we're going to find that out. So right here we have 2 times to as many as 7 times as many beds. And here's what the coercive treatment numbers are telling us. So the best numbers we have, 22 states. The data here is, again, across the country, it's appalling. And in California, it's particularly appalling because there's a mirage of it looking good in California, but it's actually not good when you start delving into it. So we have 22 states. The rates of psychiatric treatment are involuntary psychiatric detentions are increasing at 3 times population growth over this 5-year period. That's 600,000 detentions across the country, which is about 357 per 100,000 people. And that is double or triple or more rates in the UK and most other comparable Western countries with similar mental health care systems. So what this is telling us is the United States and Canada, incidentally, as well, is very high as well, are using mental health incarceration as an extension of the police state that is already itself, as we know in America in particular, very, very large police state. And this system is being used as an extension of that. So the numbers in California in particular are up there at the average, around 308, except here's an audit was done in San Francisco, and they found that the actual number of emergency psychiatric detentions was 9 times higher than the institutions had been reporting to the state officially. So that put it at 1,600 per 100,000, which would be by far the highest rate in the nation, 5 times the national average. So if that's indicative of what's going on across California, and we don't know because the numbers are just so poorly reported, if that's an indication, like, wow, there is a real crisis of emergency detentions going on. And then you add the FSPs to that, the full service partnerships, where studies have shown that about 60% of those actually require treatment compliance. So it's not in the law. These people are not necessarily being legally detained or forcibly treated under the law, but they're told essentially, if you want this housing, you have to take these drugs, or if you want these services, you have to take these drugs. Another thing I want to highlight that's going on is we have this picture often that, oh, yeah, homeless people are doing all sorts of crazy things, and that's why, the police, unfortunately, have to show up and take them away. We have this sort of image that's presented to us. Well, it's the exact opposite. An amazing study was done here out of San Francisco, where it was about complaint-oriented policing. 90% of police homeless interactions were initiated by 911 or 311 calls by other people, right? So they're basically getting homeless people in trouble for sitting or lying on sidewalks, camping, trespassing, panhandling. So it wasn't that homeless people were being so disruptive, the police had no choice to show up, but basically neighbors and businesses and other people were constantly calling, trying to either get them help or get them in trouble, one or the other. And so this is that, huge, huge issue. And so another example of that was from Oregon. They actually did a study, and they found that in 1 year, more homeless people in Portland were arrested or detained than the federal homelessness count had even found in the city. So that's how aggressive we're being with policing homeless people right now under both mental health laws and criminal laws. And this is manifested now in the Department of Justice has been suing states, finding that in large institutions, tens of thousands of people around the country are being held in these institutions when they don't need to be. But doctors are just saying, well, there's really nowhere else to go. If we let them go, they're going to degenerate. So we can't let them go. We're going to keep them locked up in a psychiatric facility all this time. And so it's just a major issue that's been going on now for a decade, where the Department of Justice is suing multiple states at once. They got more in the works all the time. So this is just a huge national trend. So do we have any evidence that any of this helps? Scientifically, no. So here's just some selected quotes from the peer-reviewed literature. Use of seclusion, physical and chemical restraints are very common, despite a remarkable lack of evidence to support their use. Locked wards, constant monitoring, emergency medications are not supported by evidence or difficult to justify. These are all from scientific studies, often by pro-force psychiatrists, incidentally. Psychiatric forced medication is a remarkably understudied practice Involuntary treatment is based on tradition rather than evidence, and there's no evidence for public safety arguments, no reductions in serious violence. And of course, we have all these harms that people have already been talking about, conversely, to counterbalance against that. The most startling being that is suicides after psychiatric hospitalization seem to increase 100-fold or more, 200-fold, 300-fold, even among people who were not suicidal prior to being hospitalized, even among voluntary patients. So I just want to highlight there. So you'd say, well, what is really going on? How is involuntary commitment being used? And it's not only being used against homeless people. And this is just some of the things I explore in the book, all these other kind of social circumstances where psychiatric detentions and strong sedating or tranquilizing drugs are being used against people's will. And of course, within that, as others have already highlighted, a lot of prejudices, a lot of biases, all the dominant prejudices in our culture today are prominently coming to the fore in a lot of these kinds of situations as well. And this is why, in the wake of the United Nations Convention on the Rights of Persons with Disabilities, they've declared psychiatric interventions that are involuntary to be arbitrary detention and torture under the convention. And the World Health Organization recently put out a guide to remove coercion from mental health laws altogether. And so America, and particularly California, is going in the opposite direction now to what the dominant recommendation is really internationally after extensive consultations and scientific research. And there's just that talk I was highlighting. So I already gave you the link, and that's my book. So thank you very much.
Thank you, Rob. That was great. That's a lot
Rob,
of stuff
I'm
in
gonna
just a
send,
few minutes.
Rob, I'm gonna send you my book and get you to sign it.
All right.
I see Mary Jo has raised her hand. I don't see her though.
Mary Jo?
She may not be able to unmute unless you can find her.
Oh, okay.
You know who is here, though? Emily is here.
All right, Mary Jo, go ahead.
Okay. I love what we're talking about, but I'm also have a mindset of let's live in the solution and not the problem. And I hate to be a pessimist, but I think this is probably going to pass based on the hype that's out there and all of the media hype and everything else. So my first question is, how do we as advocates get at the table as soon as there's a time period between passing of the prop and development of the regs? How do we get our foot in the door during that period of time when they're figuring out how to do it and to be at the table? That's number one. Number two, we need to get out into the media, and I'm hoping to do this in San Diego by May, the positive recovery stories. The media needs to know that people with mental illness and lived experience have incredible recovery stories, that we now have a career path, just like SUD and nurses' aides get certified, we get certified. We have a career, and we need to start pushing that out, those stories out into the media that counteract all of the garbage stories that are going out. And that's kind of where I'd like to see advocacy go after the prop is voted on? Anyway, that's kind of where I'm at, and those are a couple of things that I'm thinking about in terms of solutions once it's passed.
Thanks, Mary Jo. That's really important stuff. I mean, one of our biggest frustrations with the last couple of years with the governor and his programs of Care Court, SB 43 and now Prop 1, has been the fact that the people that are actually depending on these services, the people who are actually providing support to these people are being left out of the discussions. And unfortunately, when you have a governor who's this dismissive of the populations that are supposed to be being helped, you're not likely to come up with some really good solutions. There's a phrase that we've been using for quite a while: nothing about us without us. If you're going to make laws relating to mental illness or the homeless issue, ask people who have diagnosed mental illnesses, and ask people who are unhoused, and find out where they are coming from, what they actually need. It's not very useful if you just sit on high and say, "Oh, I'm just gonna, go to the French Laundry and just make my decisions." It's just there's a big disconnect between this power structure and what's been happening, and then the people that are going by. The next couple slides, and I want to get there's a lot of Q&A, and I want to start getting to the Q&As the questions as soon as we can. We've answered a few of them that were fairly uncomplicated in the actual Q&A window, but I want to try to get to those. The next two slides you will be getting, which are basically resources, and actually I might just go ahead and show you.
Yeah, and
Okay.
Emily's here too.
So these are resources and news stories. So you'll be getting these, so I won't go through them or anything like that. See, it's 6:41. Let's go ahead and get one more story. Emily is here. Emily has been part of the group fighting against Prop 1 and Care Court and whatnot for quite some time. So I'd like to give her the opportunity to share her story. Now I'm going to see if I can get back to it.
Yeah, I'm here, but I can't turn on my video. Can you hear me?
Yeah, we're going to try to, let me stop the shit. There we go.
Yeah.
We can hear you. We're good.
Okay, I still said you cannot start your video because the host has disabled it, but I can definitely share my story audio version. Hi everyone. So my story, I was so glad to be able to do a webinar with Rob in January, and sorry it's so messy. I mean, so loud over here. I'm still in the airport and just getting back home. And but 7 months ago, I was basically hospitalized against my will, and it was so frustrating because this mental health system basically overreacted and put me in the ER, my local ER, without bringing out a psychiatric mobile crisis team. And then I was mistreated in the ER, and I was also mistreated in the Kaiser mental health system. And then after 50 hours, I came back home, and then they gave me a bill for over $3,000. I'm like, oh my goodness, like, how screwed up is this system? It's so absurd. And just being able to meet Rob after my 5150 just made me feel so validated that I too also need Rob to sign my copy of my book. Your consent is not required, because it's just, the system is so absurd. And Rob knows that I want to write an Imari too. Like, I've said how I need to write my own one-woman play because this system is so effed up, and the laws just don't make sense. How can, if the law can allow for people to be psychiatrically put in detention in the hospitals against their will, then why the F are they making people pay for it? That makes no sense. And so I ever since I discovered this group, Californians Against Proposition 1, I'm and learning about how other psychiatric survivors are experiencing such terrible things like what I experienced. I'm just like, wow, I have to be part of this team, even though I'm not, we're doing all this work from our hearts as volunteers. And, I believe we have justice on our side, because when anyone hears our stories, they must be heard. And the system has to know that this just makes no sense. And so, yeah, thank you so much, Rob, for all the investigative journalist work that you do. Kalechi, you too, all of you, everyone of you on the Cap One team, Californians Against Proposition 1, you are my family, because my family, my biological family, does not know how to advocate for me. And I feel like I have gained a new family outside my family through this team. So thank you for all of your hard work from the bottom of my heart. And I can't wait for to hang out with you guys in person. Much love to all of you, and thank you everyone here for being part of this webinar. It means so much to me. Thank you.
Thanks, Emily.
Love you, Em.
Yeah.
Adore you.
Oh, there she is, finally. On video. I love that. Emily does bright green better than anyone else I know. She's amazing.
And the ironic thing about, the me being 5150 7 months ago was that I used to be the face of the California mental health movement when it used to be called Each Mind Matters. And that initiative was paid by Proposition 63, the Mental Health Services Act. And so I was their token. I was their token Asian to tell my recovery inspiration porn, and they didn't even pay for it. So it's just bizarre how things work, and it's just like, oh great, thank you for betraying me, mental health system, when I used to promote your mental health system, and then I was never psychiatrically put in detention 5150 until 7 months ago. I'm like, wow, so this is what Ellen Sachs experienced. This is what other psychiatric survivors experience all across the nation. This America needs to do much better. We have to do better.
Absolutely. Thanks, Emily. So I'm going to go back to the Q&A. Yes, thank you. I'm going to go back to the Q&A, and we're just going to have the panelists jump in as they see they have good answers. So the first one I see here is, can you talk about why the local programs focused on specific populations are most likely to be cut? I don't think it's the most likely to be cut, but it's one of the more likely to be cut, because they tend to be smaller programs. They're not doing, they're not like large organizations doing full service partnerships and such. They're really focused on the smaller things. And so they're smaller, and they tend to have less political clout. And it's going to be a Shark Tank with less water and more sharks. I don't like calling my colleagues sharks, but you know what I mean. Basically, you're in a place where more people, or just as many people, are going to be competing for smaller things.
Yeah, can I add quickly that a lot of folks who are peer run or local programs are funded through prevention and early intervention dollars. And since that money, which is upstream, doesn't require Medi-Cal billing, that's why a lot of those things are going away. They're taking away innovation, another thing that doesn't require Medi-Cal billing, and innovation and PEI funds usually fund like more like specialty populations in a different way. So that's the piece, is because where PEI dollars are going.
Next question was about I think it was about maybe 6 years ago, the people of California passed a Proposition 2, which is called No Place Like Home. And that money was for the housing interventions, and housing was coming out of Prop 63 or the MHSA. So where does that piece of pie go? Does somebody want to take that? I can generally answer it, but I will generally answer it. Just jump right in. I'm going to try to keep things moving here. Basically, the no place like home piece of the pie is still there. It's not being affected by Prop 1. Has it been effective? I supported it wholeheartedly, but I'm a little bit upset that I did because it really hasn't been as effective, nearly as effective as we liked. And I think that when the government tries to do housing programs, it's often extremely inefficient and slow in implementing it. Even if it's a really good idea, sometimes I think, and this is my own general opinion, that for the government to do it is going to be incredibly inefficient. For the government to support this kind of program can be a lot more efficient. And that's where we generally need to go for the government to support programs that are going to increase the affordability of housing, which is really the biggest problem in our with our homelessness. Yes, there's a Venn diagram, as I like to say. Some of the people who are homeless are mentally ill. Some have drug addiction. Some are immigrants. Some just are victims of a family breakup and they don't have 1/3 of the income they used to have. Some lost their job for 3 months and they were already on the edge, living hand to mouth. So there are a lot of issues there. But generally speaking, the No Place Like Home won't be changing to the best of my knowledge. Let's see, what do you think we can do to really shine a light that the unhoused challenges are not only related to serious mental illness? I kind of said something about that, but does anybody have ideas about how we can shine that light?
Rob does.
Of course he does.
Yeah, that's one that that one
He's
quote
doing it.
unquote drives me crazy. Yeah, I hate it because if you even look at the survey that was done specifically of homeless populations in California recently, and how it's been spun, the actual details show that it looks like maybe 10 to 16%, somewhere around there, qualified as being like having been labeled as, seriously mentally ill. All the other stuff was like these surveys they did around, have you been feeling anxious or depressed over the last 30 days while you're homeless? Right. And that's the number. It's that second number that gets propagated. It's in the legislation even, right? And the preamble, 80% of unhoused people struggle with mental health conditions or whatever. And that's how the media is replaying. And I can't stand it, right? Because already just the diagnoses are so dubious to begin with. But when you start compounding them with, these things like mental health conditions, like depression, anxiety, or whatever, like it's just off the rails, right? And so the evidence is there; it's as clear as day. And it's like somehow news media, somehow the legislators, they just don't want to really see it, right? They want to spin it the other way because there's an agenda here. There's an agenda of, we want to grapple with this issue in this particular way.
And when you talk about agendas, I always refer to Watergate, which is follow the money. And usually those agendas, if you follow the money, you're going to find what people's agendas are, whether it be the hospitals, whether it be the prison guards, whether it be the pharmaceutical companies, et cetera. So
yeah, that and these political parties get to kind of blame, rampant economic problems and unaffordable housing and low wage rates and lowering welfare rates. Like they want to blame all that on mentally ill people. Right? That's what's really happening there. Like, because you're seeing both conservative and liberal governments do this across the country. And you just can't help but think it's a great little excuse, right? And I don't have to grapple with anything seriously suddenly.
And I hate that everything gets labeled as mental health when, oh, he shot up the store. Oh, that's mental health. No, he was just pissed because somebody told him no. And you want to say it's mental health. No, everything's not mental health. Some is just entitlement, being unhoused, being poor. Everything's not mental health. If we keep labeling everything mental health, it discounts the real issues.
All righty. Okay, I'm going to get to one more, and I see Johanna's raised her hand. We'll get to that one next. I'm going to try to jump back and forth. this is a really important one, and it's something that I've been asked a number of times by reporters, by mental health agencies. But what are the alternatives to Prop 1? I'd like to hear some of the panelists' ideas of what are some of the alternatives. This attendee said that his friend was killed by police when he was experiencing a mental health crisis, and he had no family support or help, and was one of the millions of people who fell through the cracks. So if what we're doing now is not working, is it working? Is it failing? Is there something we can do differently? In other words, if not Prop 1, then what? And I'd like to hear some concepts from our
Yeah.
panelists on this.
First, I want to say I'm so sorry for your loss, and I'm so sorry that a mental health crisis often ends in fatality, and that's not what anyone needed or deserved. So first, want to say that. The second thing that I put in the chat earlier is that, and I don't know why they're not funded, and we haven't funded them. We could have peer respites. We could have a peer respite in every county where someone with lived experience, a team of folks would support other folks who are actually in a crisis. Because a lot of times we need a place to be in a crisis where we're not going to be forcibly treated, where we can de-escalate and ground, maybe have like wellness recovery action planning, whatever it is, group support, peer support. But peer respites have been something that have been proven to work, and they are not funded because of the stigma of people with lived experience. The stigma that we can't actually heal and or support each other. But if we were actually to fund those, they would change. I mean, so many problems would be solved. A lot of problems would be solved. So I've always will put that's my number one ask, is like funding peer respites.
I would say, let's get the police to get at least peer certification or mental health training, de-escalation tactics. And honestly, because I'm petty, I would like them to continue maintain get new certification every 2 years, and they have to get CEs to know that they're knowing what de-escalation tactics are, cultural competency is, and how to help people with mental health training, mental health issues, because they just go in immediately with they're violent, let me do something. And that's not the case always. Yes, stigma equals discriminations, exactly, yes.
Emily.
So I've been writing in the chat box that I definitely think that, well, Rob and I met because of the 988 federal issue, and 988 crisis counselors, there's no standard training that they take. And so I think that in the state of California, that the 988 crisis counselor should at least be trained in the Medi-Cal peer certified trainings, so that there is some sort of level of consistency in this entire state of California. I think that should be mandated. We should have peers always involved in psychiatric mobile crisis teams, mental health evaluation units, working with the police, and so that it's not so daunting for a person in emotional crises to have so like a peer, right? A peer. I think we all can agree here that peers, to a certain extent, have the ability to empathize, because we've been through emotional crises before. So why can't we be included in the conversation to be a support to those who are having those emotional crises? So funding those kinds of programs, because my 5150 happened around midnight, and it's like I keep on asking the board of supervisors, where were they? Where were they? Why did they not show up for me? And they did not show up even for my uncle who died in a psychiatric hospital, just because the ER social worker thought, oh, he should be 5150, and he got transferred into a hospital without telling the family, and then he died the next day. It's like, what? We need to do better, and we need to include peers And if this Proposition 1 does not include peers, it is going to be a grave danger to the peer workforce in mental health.
That's very true, and that kind of speaks to the whole issue of the rhetoric that's being used about letting people die with their rights on. Meaning, if we don't violate their constitutional rights, they're going to die. And in fact, as in that case, they violated his constitutional rights possibly, and he still died. So, forced treatment does not eliminate that problem. I'm going to go to a raised hand. I've got Johanna, and I just allowed you to unmute, I think. Let's see if it worked. Johanna? Johanna? Sorry if I'm mispronouncing. You can go ahead and unmute. Do you have a question? Ah, there you go.
Hello.
Hi.
I just wanted to know, when I was in bachelor's in tax in California, it did a lot of work. And I throughout the years, about a span of 4
You're
years.
breaking up. You're breaking up.
I said it's been a span of 4 years. And so I
Can't understand you.
Hello, how about now?
There's a lot of background noise. Is there any way for you to put your question in the chat? I mean, we'd love to hear it, but it's hard to hear you.
Yeah, 1 second.
Thank you.
Thanks, Johanna.
Okay, how about now? Can you hear me better?
Yeah.
Yes, yay.
Okay, perfect. Yeah, so I just wanted to say that I was working with Access California for quite some time, and we were monitoring this for about 4 years. And I just started feeling, I've done a lot of advocacy in the environmental areas. I don't know if anyone follows the IPCC report, but it has to do with climate change. And one of the biggest issues that is occurring right now through the IPCC report is that mental health crisis is going to increase due to people losing land, their families, with climate change. So with that being said, I found that this policy, like Prop 1, is really being forced on. I don't know if we're going to be able to stop it. Like, honestly, I feel a little hesitant. Like, I've been working on some other advocacy things that have taken over decades and decades, like even before my lifetime, but I still continue to fight, that are, environmentally, are about the environment. So one thing that I started to do was thinking about my own community and how to help it without, like, having less, not being impacted so much by care court. So my community, East Los Angeles, has a large immigrant community. So I've been looking at different lawyers and people that can speak up when care court comes around. My biggest concern is the children, because families will be separated once people are put into conservatorship, right? And sorry, I'm like kind of all over the place, but also going back to like care court being taking 4 years to just get to this point, and no matter how hard we fought, it just kept passing. And again, like, a lot of it was illegal if you look at it. You know how it was passed, like all these little things from all these different areas, just changing what the word gravely disabled is being labeled as. So I just wanted to know, oh yeah, and then there's like all this money, right? Follow the money. But I'm wondering, like, have we heard anything back of how San Francisco is currently, like, do we have any stories from people in San Francisco? Like, how are they trying to protect themselves since care court has already rolled out over there? And have we thought about how we can even go to San Francisco and point out, oh, see, this is a flaw here, this is a flaw there, this is what's happening to the community, and think about how we can, because in Los Angeles County, we're not going to implement it until 2026. So I'm wondering, is there anything we can do to, again, lessen the blow when care court comes around? That's a lot, sorry. Thank you for listening.
Yeah, who wants to take that one? It is a lot, thanks.
I can
For any piece of
start
it. Yeah,
just for a piece of it. So, I mean, I think what you're bringing up a lot of different things, but I think the thing that you brought up is also something that Mary Jo brought up. So you're bringing up, wow, care court is going to happen. How is it rolling out now? And Mary Jo brought up, like, if Prop 1 happens, how do we kind of fight? So if the thing we want doesn't happens, how do we actually, come together, fight it? So I mean, there's a lot of different ways, and there's a bunch of advocates on this call. But one thing is, all the counties have Mental Health Service Act coordinators, they have Mental Health Service Act planning. They're going to have to, like, come back to the community if certain things pass. They have care court conversations, they have work groups. Be at those work groups, join everything, sign up for your county's list of all the different meetings, but specifically ones that are around either Prop 1. We are not assuming it's passing here because we are saying no against it. We're not giving up our fight. And strategically, really get plugged in to different counties and, kind of what the implementation is. And then, I mean, I think there's a kind of gathering of like minds, right? There's lots of peer-run organizations. There's a lot of people with lived experience who are talking about, here's what I've done here, here's other things. It's a lot of informal. So how can we actually gather together to talk about how are things implementing and what are the loopholes? What are the things we need to learn from each other? So I would just kind of say that we could start there. I'm burnt out on all of the things, so I'm not on all these work groups, but there are people who have a lot of energy and who are joining and sharing information. So I think there's an encouragement of, like, trying to learn from one another about what's working, what's not working. And then I would talk to harm reduction folks. I would talk to people who are unhoused who really know how to, like, avoid being detained. Like, where can we maybe have a training of, like, okay, your rights are going to be taken away. What do we need to know about this? How can you avoid being conserved, right? That's probably another training that hopefully one of our groups could put together.
but definitely here on the whole concept of, we can't do this individually by ourselves. We have to do it in coalitions. We have to get together with other people of like mind, or at least semi-like mind on specific issues. I mean, they're in the coalition against Prop 1. I mean, I'm going to send out a list of all the people that are against it. And it's not just the same people. It's not just civil libertarians. It's not just peers. It's not just the anti-tax people. It's not just any of these people. There's a wide coalition, and we have to work together to take care of what we need. Andy Herman put into the Q&A asking basically, are there any legal challenges gearing up to challenge Prop 1? I would like, I know that there's a group called Disability Rights California that's also part of the No on Prop 1, who worked on care court, and they filed a challenge to the Supreme Court, which was rejected, the California Supreme Court, which was rejected. But if you're interested in legal aspects of that, in terms of particularly where you're talking about gravely disabled or severely mentally ill, I do recommend, I mean, I do encourage you to reach out to Disability Rights California. They've got a bunch of lawyers, and they know their stuff. They don't necessarily know mental health as well as some of the rest of us do, but they certainly understand and get the legal aspects of what's going on. Andy, I hope that helped you a little bit, but yeah, they're the group that has the attorneys that most of our groups that are opposing this don't have. And so they've been a big support for us in that way. Anyone else real quickly on that before it is past 7, but I'm going to stick around at least till 7:30 to keep going with Q&A. But this was supposed to be an hour and a half, and don't think that you have to stay if you don't want to, but please do. Okay, then I see Christina had a question in the chat box, and she also has her hand up. So her question was, who determines what's enough when we have when we have misleading data? Doesn't the data determine how much funding is needed in each county? And I'd say the data typically with the MHSA, as it has been, the money is sent out in the only way they can, which is basically based on a formula. I'm not an expert on the formulas they use, but it is largely a matter of population and that sort of thing. Christina, I'm going to go ahead and allow you to talk in case there is something else or something related that you wanted to ask. Christina, go ahead. Excuse me. Christina Murphy, I see you there. You've got your hand up. You're unmuted. I can't hear you.
Hello, can you hear me?
That's better. Thank you.
Good evening, everyone, and thank you for this opportunity. And I just want to say thank you, everyone, sharing their personal story. That is the main impact. That's what matters right there. So thank you, three ladies, and everyone else that took their time out. This is what I want to ask. I want to know, how do we get here? Like, how do we get to this point? Because all year, I know, like, for the last 5 years, maybe even for the last 10 years, I've been fighting and advocating in the community. And we've had plenty of talks at the table with the funders. Governor Newsom, he supported the peer support specialists, and so how do we get here? Because what I'm hearing, and at all these different meetings I go to, it's like, hey, we're being cut in this area, but we're going to be pushing it over to this area. How do we get to a point where we feel like we pull from this area to help this area, instead of asking for the MHS 1% to go up to 2%? Like, how come we're not advocating for that? My question is that there's like thousands and thousands of us peer support specialists. Some of us, like me, California State certified. Some of us are taking like the trainings to get there, but there's thousands of us that are working, providing great services. That, yes, not getting paid livable wages, but we're still providing the service with a happy face, with our hearts like loving, with our real authentic ways, selves, with our tools. Like, how do we get to that? Because at first it was about, let's get everybody trained so that, because the clinical services are not really working. So we see that. So now we need the peer support specialists that are in recovery, wellness recovery, to come back and show us clinicians, how do y'all do it? Let's sit at the table together and collaborate with the person to discover their own goals and gifts and help them accomplish them. That's what direction we were going in, because I helped start and run first Sally's Place, first peer respite in Alameda County. So I know it was working. And I know services like that work, and everyone in the county and in other counties was excited about it. But now we're at a place where we're talking about, well, the money is going to go to substance abuse and housing. Well, if like, how can you deal with substance abuse and housing without dealing with mental health? And how can you deal with that without dealing with the other parts, like education and support, like the 5 core concepts of having wellness recovery? Like, how can you move the money without discussing asking for more money? And we have this accountability part, right? Like, I appreciate most of the people on the accountability, but we have to be honest. There's no accountability in some of these areas, and they already got the funding. So when we talk about, well, this money is going to go where it's going to come up with new solutions. Well, we've been at the table having these community workshops, these community powwows, where we telling like the people that don't lead the podium, like, this is what we're needing. We need alternative services. We need someone that's been through what we've been through, to sit with us and to support us through the journey. Not tell me if I don't do this, then I'm not doing right. Like, and so my question again is, and I'm a person that's been voted in by almost 40,000 people in Berkeley when I was on the Berkeley Rent Board, and I was on the Police Review Commission, and I was on a whole lot of stuff, and I'm still on a whole lot of stuff. So I think I have like some privilege to where I get to like have a little bit of passion behind my voice, because I just don't understand the talks. I feel like we should be having webinars and talks on how to mobilize, like how to get all of us that are well, Each Mind Matters, all the programs, POCC, Share, all the programs where people are living in wellness recovery day by day and dealing with life on life first. We need to be mobilizing. Where's the funding to get us on the plane, to get us on bus trains and automobiles so we can go out with signs and make some noise like that, because that's what worked. If Sally was here still, rest in peace, you know, she'd be like, let's mobilize. Thank you, and I'm sorry if that was long, but I'm not sorry, and so thank you with love.
We're not sorry either, Christina. Thank you very much. And you know, you're looking at several people that when some of these laws were being passed, particularly the enabling laws for Prop 1, went to the committees and the legislature and said, you know, if you're going to use some of our money for some of these programs, raise the tax. You know, don't, if you want us to do more, then give us more money to do it with. And the governor's office basically just laughed at us. They did not respond well, put it that way. And you know, the consultants from the committees came back and said, yeah, it was a non-starter. He's not interested in that. It's a political thing for Newsom, and I don't want to get too much into Newsom bashing, although it is fun. But you know, it's a political move. This is part of his run for president, and we'll see how that goes. I think the best thing we can do right now to start improving things is to hand him a defeat on March 5th. Is to beat this Prop 1. Spread the word. Get everybody you know. Get everybody that you know, and who they know. Social media is an important thing, but. Yeah, encourage everyone to vote no on Prop 1. And I tell people, if you don't completely understand all 68 pages of it, join the club. There are probably like 10 to 20 people in the state that actually understand every bit of it. It's incredibly complicated, it's incredibly long, and it was done intentionally so that they can just run ads and say, we're going to help the veterans, we're going to help the homeless, and they don't have to back it up with any real arguments. Okay. Mary Jo, you've got your hand up. I think you're able to talk. Mary Jo?
Yeah.
Oh, okay. Go ahead.
Okay, I wanted to talk a little bit about Care Court because San Diego has implemented it. And one of the things that we found that there weren't as many petitions as we thought there would be. And then the process through the petitions is long. It's, you know, you gotta submit it to the court and then it has to be reviewed and then the care plan has to be done and then it has to go back to the judge. And like you say, it is voluntary. But what we've done down here is legal aid has a contract to educate people and protect their rights. Legal Aid, the Consumer Center in San Diego, is the designated patient rights advocate for all outpatient programs in San Diego. So if you can get through, you know, disability rights and legal aid locally, and those kinds of entities that are already protecting rights, you know, and that's another thing that I put in the chat is that, you know, where is the accountability for patients' rights advocates to be able to do the work that the statutes require that they do? So, and then another important piece to pull in are patient rights advocates and the legal stuff. I know, Rob, you're probably, you know, real familiar and aware with that, but that's one of the things that we've done. But I don't know if anybody's got numbers in terms of how many petitions there have actually been for Care Court statewide, because I'm hearing that the numbers are low.
Well, I'm kind of pleased that they're low, quite honestly, because I don't think it's a great program. But yeah, that's a good question. We're not really seeing and we're just beginning to see the tip of the iceberg on Care Court. And
Yeah.
I don't want to get too far into the weeds on Care Court right now because we're really
No, I don't want to
dealing
get
with
into
it.
it either,
Yeah.
but I wanted to let you know that we had implemented it.
Yeah.
You can
Very good.
shut me down now.
No, not shutting you down. Just thank you. Thank you very much. It's just getting late. John Vanover, you've got your hand up.
Yeah, thank you, Paul. Just want to start by saying big thank you to all of you and for all of the other tireless volunteers behind the No on One team. It's really amazing, and we're so grateful for all of you for the time you guys have put in. Before we wind down, I just wanted to see, given his extensive experience and knowledge, I was wondering if Rob could offer any bit of hope or guidance for the future of our movement beyond Prop 1.
Just one small thing I want to offer up. I mean, I don't think it is small as people are talking. You know, there are some other states that have specialized mental health trained legal teams. You know, the mental health hygiene legal service in New York, for example, and that can make a difference in these kinds of situations. And I'm thinking, you know, in the future, that's something to start lobbying for, is just, hey, at the very least, because Disability Rights California, you know, they have such a broad mandate with, you know, basically all disabilities of all kinds under their mandate and umbrella, you know, that's really, in my experience, all those disability rights groups in every state are really just struggling with their funding to do what they're supposed to do and all of that. And so I think a specialized service to represent people who are being coerced in different ways in the community, and then that service also can become more broadly knowledgeable about all these laws, because you can see even in the government instructions on care courts, for example, they're very contradictory, confusing. You know, I watched an online presentation by a judge to others, you know, and they were lost too. So I have no doubt that it's going to be a while before the care court thing really looms as the threat that it seems to be right now, that people are going to be still stumbling through, like, how do we actually implement this? And then even if we do, where are we going to keep these people? A lot of people, I think, are trying to hold off for Prop 1 to pass because they want to get the institutions in place where they're going to put those people who are going to be running through care court. So I do think that's not happening really fast. But in any case, more broadly, you know, I do see, I got to say that I'm actually feeling a little better overall. Like, I'm sorry about what's happening in California, but the reality is you're now getting where most of the other states already are. That's what's happening. You've been closer to what the Supreme Court said should be happening around these issues than other states. But what's really unfortunate is there's billions of dollars in California to throw at it. So I have little doubt that in the end, you're going to be worse off than these other states who just don't have the finances to actually back up these abusive laws they've created. They don't do a lot with them. So yeah, anyway, I wanted to say on the positive side, more positively, there's definitely growing awareness out there. And I think the intersectional aspects of this are really important. We need to be liaising across different types of groups who are working on anti-carcerality, anti-racism, you know, anti-poverty. All these issues are totally related. And it's 10 years ago, I didn't see that. You know, people that were speaking out against involuntary commitment were largely isolated away from these groups. And now more and more of these groups are going, hey, we're all in this together and we're kind of battling the same things. And I think that's a tremendous development. I'm excited about it, frankly. You know, of course, the battle is huge. The battle ahead is huge. But I'm like, something like what's happening tonight, that, you know, I think is great, you know, in that sense. And we need more of it. And that's what I'm feeling sort of positive about overall, and everybody bringing their collective wisdom together to say, okay, if we see this as an intersectional problem and a fundamental problem around the organization of society and its prejudices and biases, then what's the way forward? It's not any one of these groups on their own.
All right. That mostly covered all the Q&A. There are a couple I didn't get to. A lot of them were kind of overlapping. And so if we did miss anything, actually, if there's any other questions that maybe we didn't answer, now would be the time. We are getting a little bit late here. We went pretty, we went pretty late, but this is good. It's important discussion. It's important information. There are a lot of people with, okay, Andrea?
I think
Yeah.
Hector put their hand up first and then
Oh,
Taylor.
Hector.
Yeah.
Okay, let me allow Hector to talk. There we go. Hector, go for it.
I tell you, hey siblings, this is so good to see you all in this space. Definitely having these conversations. I am starstruck as I look at my screen. But I think one of the things that really becomes apparent is that oftentimes that particular education component about our community and the collective work that we do is so important to continue. And I think if anything, with Care Court and this, that has become apparent is that that is something that we really do need to establish. And each and every single one of you, I know personally, does this work in such incredible ways. And while we stand on the shoulders of previous advocates like Sally, you are now our leaders, each and every single one. Our younger ones look to you in the way that probably some of us looked at Sally. And so I think in the work that comes ahead after the ballot election, it's really important to develop those particular learning and collaborative partnerships. I was mentioning that Rob's book, your consent is not required. For me, as a policy advocate, I use it both as a tool to learn, but I used it also as one of the texts because it's just so comprehensive and really encompassing of the issues that are crucial to a community. So I think it's important to continue collecting that advocacy voice that we have, diversifying it. I think if anything, after COVID and all the work that we have done, we realize that one of the reasons California leads the way in so many things is because of the advocacy work that we do. Mental health services side, a lot of what the governor has funded came from advocacy. Some of it, not ours, obviously, but more than anything, I think that's an investment that I think both the counties need to have in their stakeholder programs, but then also the state. And I think it wasn't a coincidence that we didn't necessarily have that coalition support, and we were all kind of struggling to survive again during COVID. But I remember working before this measure of the challenges that we have. And, I think that for me is perhaps one of the biggest glaring goals out of this, having seen measures like this come back and just kind of seeing the writing on the wall at the state and federal level. So I think, I really want to thank all of you for being here and educating us. I don't know everything, none of us do, because we're not privy to the information. And that's part of the disparities as we, as people with disabilities, face. And, really unifying our psychiatric or, mental health or SMI community into the disability community, perhaps might be our biggest impacting effort. California leads the nation in civil rights and the disability community for a reason. And so so thank you, Star Trek, Rob, Latanya, Paul, and Kaleshi. And I'm really, really glad that you're holding this space for our siblings.
Thank you, Hector. It's very kind.
Thank you.
Thank you, Hector.
And Taylor,
Can y'all hear me?
we can.
Okay. First of all, what Hector said, yes. Also, Paul, I saw your reply to one of my questions in the chat, and so thank you. I just wanted to also open that question up to everybody else and say, like, if anyone has sort of advice on where I should look to learn more about like the oversight issues that we've seen so far, and also just the history of the MHSA and kind of like if there are failures that could maybe indicate how historically California has failed in this. I'm trying to learn more about it. So please let me know who I should bug.
Oh, geez. Oversight's such a huge thing. They're claiming that the Prop 1's going to fix that. I have zero faith that it's going to. When Prop 63 was first created, it was there was an Oversight and Accountability Commission, MHSOAC, which was charged with a lot of that work, and they have not done a great job. I think they're probably doing a better job than putting it into an overall umbrella. The Department of Healthcare Services is going to do, because they're not. At least they were specialized just in this particular environment in terms of the MHSA. But there have been failures for sure in the oversight. Part of it was, bottom line, they didn't do a great job. Part of it was that they were underfunded to do some, they weren't funded to do some of the things that were expected of it. And that's, of course, in California and in a lot of the country, that's endemic. Legislators say you got to do this, you got to do that, but they don't fund it well enough to actually do it properly. So I give negative kudos to both the OAC and to the state and the DHCS, because actually the Department of Healthcare Services that's getting this additional money, they were given a horrible grade by the state auditor on how they were involved with the oversight of the MHS OAC. I really believe that the more control we have at the local level and the less meddling at the state level, we might be better off without an oversight and accountability commission, or the DHCS. I wouldn't want that because we need accountability in all the taxpayer money that we spend. But I just believe that real accountability happens at the local and individual level, not at the not some, somebody at DHCS in Sacramento running a spreadsheet to see what's happening. Mental health is more complicated than that. As I'd like to say, if you get 10 people coming into an emergency room with a broken leg, they're all handled the same way, and you can measure that. But you get 10 people with mental health crises coming in, and you've got 10 different ways to do it, so which makes accountability and that sort of thing really difficult. Rob, it looked like you were about to say something.
Yeah, I just wanted to continue on really from what you're saying, Paul, on that is something I talk a lot about in the book, right? Is this problem of accountability and oversight. And, a couple of things I do think it would be really easy to create better quality of life outcome measures for all mental health services, voluntary and involuntary, that we could be more regularly monitoring. Like, do people get back on their feet? Do they get back to work if they were out of work? Are they no longer homeless if they were homeless? Things like that. And we aren't measuring that hardly anywhere. And anywhere it has been measured, the mental health system fails and fails abysmally, generally speaking, right? So yeah, we need to measure it and find out what's working, what's not working more regularly. But the other thing is, we got to highlight that. I think you were just beginning to touch on that a bit, Paul, was there's this problem here within the mental health system that it is difficult to define. But that becomes a real problem with accountability too. That's why we need these quality of life measures, because you can't really tell just by, well, somebody's symptoms apparently went up or down or something like this. That's not much of a measure to begin with, let alone to end with. And it's so hard that even the Department of Justice highlighted this to me, in an interview on the record, when I was saying, how do you catch the fraudsters? How do you catch the people who are literally just locking up anyone they want and abusively, detaining them and drugging them? And they said, yeah, it's hard because it looks a lot like the good ones. Right? They didn't say it in those words, but that was the essence of it, right? Where they admitted, even when we have an auditing team going into a facility, it's kind of hard to tell, because blatant abuse of a person looks remarkably the same if you're doing it purely for profit or if you're doing it with supposed good intent. And we have to grapple with that as a society right now, that, yeah, like if you're talking about outcomes for involuntary treatment and oversight of that, no, you can't. You really can't. We got to get rid of involuntary treatment. It's just not something that can possibly be, safely done. Really, it's just it's like an oxymoron to say safe and good involuntary treatment.
Thank you all. That's super helpful.
Thank you. Yeah, and I put into the thing, the other aspect of mental health outcomes. It's pretty easy to determine what would have happened if a cancer tumor hasn't been removed, but it's almost impossible to tell what would have happened without whatever intervention or treatment that you give. You don't know what would have happened if they hadn't gotten that treatment, or if they didn't get it, you don't know really what would have happened if they had gotten it, because it's still an incredibly complex. The brain is by far the most complex organ in the body, and the mind is 10 times as complex as the brain. So it's a difficult measure, but as you say, Rob, the outcome measurements that you're talking about are probably as close as we can get. is those outcome measurements are probably going to be the best way that we can do it until we know a heck of a lot more about the brain and the mind than we do now. Population control. Okay.
Well, on that note, I think you have a last slide with some resources. I know we're
I will share
a
that.
bit over time and we're gonna close up, but are there any, Paul, are there any last things around like resources we want to share with folks, or the fact that people will get a recording of this at the end?
I would, I currently sit on a DHCS, Medi-Cal Managed Care Advisory Committee. And in May, our topic is going to be mental health. I'm gonna put my information in the chat because I'm trying to gather stuff that I can take to that committee. I have found them to be extremely responsive to the input that they're getting from members of the committee. So it's DHCS, Medi-Cal Managed Care Advisory Committee. And I'll put my contact information in the chat.
There it is. Okay.
Thanks, Mary Jo. That's a great way to advocate, actually. So a lot of you all are calling for advocating, organizing. So please get on the California's Against Prop 1 list. It sounds like we probably need some future organizing depending on what happens after March 5th. But yeah, I'll turn it over to Paul to get us out.
Alrighty. So this is the information for the campaign, info at Prop 1.
Oh no,
Is Paul frozen or did I freeze? Okay, Paul froze. Okay.
Paul froze.
Oh, there
I
he is.
froze. Can you see me now? Can you hear
Yeah.
me? Okay, when I tried to share the screen, it ran into trouble, but I'll try it again here. Yeah, so these are the organizations that actively came out against Prop 1. So there's quite a few of us, and we're not just a few people, although we're a lot fewer than what the governor has access to. And these are different newspapers and such who have come out against Prop 1 as well. So there are a lot of, we're not in this alone. Reach out to your local media, reach out to your local organizations. And yeah, I think I'm going to stop that now. You will get, I know I flipped through those really quickly, but if you were here and logged in, you should get the slides in fairly short order. So you'll be able to see all those things. Thank you so much, Rob, especially for being here, but all of you for being here. It's been great. It was a terrific discussion. I think that there are a lot of good questions, some of which we don't have answers to, but certainly, I think we can begin to have answers with discussions and seminars like this, that we can begin to really find some better answers than are being proposed at this time, and tell everybody you know to vote no on Prop 1. That's my final word.
Thank you.